Hello everyone, welcome back to Tamali's classes. In this class, I'll be talking about drugs and alcohol abuse. This topic is in continuation with my previous class of cancer, and it is the last topic of the chapter Human Health and Disease of class 12. This topic is also a general topic, and anyone who is interested to know about it can go through this video. So in this class, I'll be talking about what is the drug and alcohol abuse and what are the causes that are leading to drugs and alcohol abuse and how can we prevent them. Okay, so let's start with the first slide. That is the list. I want to introduce to you about what is drug abuse and what is alcohol abuse. So see, everyone knows about drug and alcohol. They have heard about the terms. Okay, so this type of this drug abuse and alcohol abuse is one of the most threatening type of abuse or that is happening in today's generation or in around the world. Okay, most of the like age group of 30 years and below 30 years, they are more into these drugs and alcohol. So why, what is happening? So let's talk about that. So first, let's know what is drug abuse. So drug abuse is when an individual keeps on consuming drugs. Okay, when he or she takes on drugs continuously, what does happen? This drugs, it leads to the activation of brain. Okay, the brain system gets activated, and there's a temporary feeling of pleasure, and it's also creating good memories. Sometimes people say that they are on a high. They use the word high term. So basically, what is it is that people try to take drugs when they want to deviate their mind from something unpleasant. They want pleasant memories. They want to get a temporary feeling of pleasure. So this type of continuously taking drugs is known as this type of this thing is known as drug abuse. Okay, so this is also leading to an disorder. There are some disorders which are happening because of drug abuse, because if you are continuously taking this type of drugs, what is happening is your brain is getting activated. Okay, your brain system is getting activated, but it is leading to some type of disorders. So basically you will see that there are some sleep disorders. You don't feel sleepy, and like sometimes there are some bipolar disorders, and also sometimes you cannot act well, you cannot think well. Okay, so you cannot understand the things properly. So there are many type of disorders that are occurring because of this drugs abuse. Fine. Also next is that, okay, you also away from respond, you don't take responsibilities, you don't have proper judgment. So all these are occurring because of this drug abuse. It's leading to many other disorders. So now they're talking about alcohol abuse. So alcohol abuse is what, when people are taking continuously, they are taking in alcohol on certain occasions. You cannot say that every day who a person who's taking alcohol, because such type of thing will become alcohol dependence. If a person is taking alcohol every day, then it's becoming alcohol dependence. But on certain occasions, when people are consuming too much alcohol, okay, which is again leading them to they think that it's for the well-being of their health. But actually when they continuously they take this alcohol, it's not leading to the well-being, but it's hampering their health. Okay, not only health, it's also hampering their judgment. Okay, it's hampering their behavior, the way they behave after taking alcohol, when that is not that is improper, when that is not proper. Okay, so basically when it's affecting the behavioral pattern of the human being, also the judgment power, okay, thinking capacity, and also their health is being affected, then these are all type of disorders caused because of alcohol. Okay, so there's another word known as alcohol use disorder, AUD, which is occurring because of this alcohol abuse. Okay, so now let's move on to the next slide. So common drugs, just a minute. So let's talk about common drugs. So I've told you about what is introduction, what are disorders led to this led because of drug and alcohol. Now moving on to the common drugs. Okay, so in common drugs, there are certain drugs which are very common, such as the opioids, cannabinoids, and coca alkaloids, and also other drugs such as the atropa, belladonna, and datura. So in opioids, what is happening? What is coming under opioids? Morphine and heroin. Okay, in cannabinoids, it's marijuana, hashish, charas, and ganja, and in coca alkaloids, it's cocaine or coke, also said as coke, and in other drugs, it's atropa, belladonna, and datura. So these are some type of the common drugs that are being consumed by human beings. Some are illegal, some are legal. in some, depending on some countries. Okay, now we'll talk about each of the drugs in details. So opioids. So opioids out here. Opioids from where, from where is it obtained? Okay, so it's obtained from a plant known as the poppy plant. Poppy plant. Okay, it's a Papaver somniferum. Okay, so from poppy plant, morphine is obtained, and then again from morphine, heroin is obtained. Okay, so what is heroin? Heroin is also known as smack. So it is basically it is a chemical diacetyl morphine. Remember this. So from morphine we are getting heroin. So heroin is basically it's a diacetyl morphine. Remember this. So what is the properties of opioids? So it is white in color, odorless, bitter, and crystalline compound. Okay, and the source is, as I've already told, of when morphine is acid, when there is a process known as acetylation. Okay, so when acetylation of morphine is occurring, then from morphine this heroin is being produced. And how is it taken in by the individuals? Individuals taken with the help of process known as snorting and injection. So by snorting and injection process, this drug can be consumed. And what is the role of this opioids drug? It is a type of depressant, and also it slows down the body functions. So this is the structure I've given out here. Now I hope you have understood this opioids. Remember this thing, the source, the plant, okay, Papaver somniferum, and heroin. How is it being obtained? It's being obtained by acetylation of morphine. Remember that. And what is the role? Remember, depressant, okay, and slows down the body functions. Next is cannabinoids. So I've already told you what is coming under cannabinoids. Okay, so now what is happening here? Now, what is this drugs? These drugs, they are obtained from the plant cannabis sativa. Okay, the inflorescences of plant cannabis sativa. So from cannabis sativa, cannabinoids are being obtained. So in that plant, the flower top, leaves, and also resin. So they are all used in various type of combination to produce different type of drugs. So outer, not only the inflorescence, the flower top, the leaves, the resin, all are being used, and in different combinations they are forming this marijuana, hashish, charas, and ganja. Now are again they consumed by the individual by inhalation and oral ingestion. So what does this drug do? This will affect the cardiovascular system of the body. And okay, now this type of drug is also used by some sportsmen. Means you can see they are misused. Okay, I'll tell you about the good effects of drugs also. See, some drugs have some good effect also, but when they are misused by some people, then it leads to this drug abuse. Okay, now next is coca alkaloid, or also known as cocaine or coke. So this is obtained from the coca plant, Erythroxylum coca, and they are again taken in or consumed by the process known as snorting. So what does this cocaine do? It will interfere with the neurotransmitter dopamine. So we all heard about dopamine in neurotransmitter. So what does it do? It will interfere with that transport of dopamine, and since it has a potent stimulating action on central nervous system, so it will produce a sense of euphoria and increased energy. When you take in coke, you will sense an increased energy, and you will feel some good memories and all. Okay, so there are some bad effects of this coke. That is, if you continuously use it in an excessive dosage, it will lead to hallucinations. Now, these are all the type of drugs I've told you. Now let's talk about the benefits of drugs. I've already told you that drugs are also sometimes used as beneficial medicines. Okay, so sometimes they are used for patients who are already having mental illness like depression and insomnia. So for those type of patients, this type of drugs are being prescribed in the form of barbiturates, amphetamines, and benzodiazepines. Okay, so these are used as medicines. Next is morphine. So morphine is basically used as sedative and painkiller, and it's also used by patients who have undergone surgery, because they will not feel the pain. They'll feel sleepy, as I've already told about morphine, that it causes sleep. Okay, so the patient will feel sleepy and will not feel the pain. Also, in ancient times, some this type of plants were used by people as folk medicine. They were used in religious ceremonies and rituals. So now this is a very important topic about smoking. So smoking also leads to drugs. Okay, it's also one type of abuse. It leads to drugs because this tobacco, it is smoked, it is chewed, or also it is used as a snuff. So this tobacco, it contains a chemical substance known as nicotine, which is an alkaloid. So nicotine, what does it do? Nicotine, when it is taken in, it will stimulate our adrenal gland, and it will release adrenaline and on noradrenaline. in the blood circulation. Okay, so when this two will be released into the blood, it will lead to increase in the heart rate, and also it will raise the blood pressure, again, which is very, very bad. Also, we know that when people who smoke a lot, they might suffer from many type of um, lung diseases. And also, not only who smokes, even who inhales this smoke, this tobacco smoke and all, it may lead to cancer also of the oral, it may lead to cancer of the lung. And also, chewing of this tobacco leads to the risk of cancer in the oral cavity. And smoking is also causing this cancers of, okay, I've already told about lung cancer, so also in the throat cancer. Then some people have bronchitis, which is again because of, one of the reason maybe of smoking. Okay, and there are other reasons also, so emphysema, then coronary heart disease, gastric ulcer. So these are all type of diseases or disorders that are occurring because of this smoking. So smoking, basically what the smoking do, it will increase the carbon monoxide content in blood. So we know that our blood, it is containing oxygen. So when CO concentration is more than O2, that means carbon monoxide content is more than oxygen, it will lead to the oxygen deficiency in blood, which is why you'll start having breathing problems. Okay, you'll be having breathing problems, and also in your lungs will be affected. Now, what's the relation between adolescent and this drug alcohol abuse? So adolescent, basically, what is adolescent period? So the period between 12 to 18 years of age can be thought as the adolescence period. Basically, also you can say that this period is the linking the childhood to the adulthood. Okay, so below 12 is the childhood, and above 18 is the adulthood. So when this period is linking both this childhood and adulthood, so during this period, a lot of behavior changes are occurring, a lot of biological changes are occurring in the human body. So this is a very, very vulnerable phase where, there are some mental development, there's psychological development in an individual. So this period is very, very critical. So parents have to take care of children who are of this type of, in this age group. They have to take extra care of how they are developing, how they are feeling mentally, and how the behavior is changing. So there are many. This is a very critical phase. Okay, just remember that. I'll talk about this more. So, what are the factors leading to the drug and alcohol abuse? Very, very important thing. Please listen to this very carefully. First is curiosity. So those people who are in that age group, or other people who are trying to get into alcohol or drugs, what happens is they have a curiosity that what is happening in this. Let's try this for once. They have a curiosity, and they need some excitement in their life. They need some adventure in their life, because they feel that their life is bored. Okay, they feel there is nothing in their life. They want to explore something new. Okay, third is they want to experiment these things. As I've already told, they want to experiment it. So they try this at drugs and alcohol. This is very, very risky, very, very scary thing actually. So also sometimes, students or children or people who are facing too much problems in their life, they think that if they take alcohol or if they take drugs, they can escape those problems, which is actually not true. But they feel like that, a temporary relief or temporary pleasure they can attain from drugs and alcohol. Also stress. Now suppose some students or some children or some adults, they feel like they are failing in some examinations, or there's a stress they are developing inside, or they have some pressure from the family or from their peers, where they have to excel in the academics or examinations. So they deviate towards this drugs and alcohol to get those good thoughts, or to get temporary pleasure or de-stress themselves. Okay, so some people also find it very cool or very progressive to smoke or use drugs. They think that if they do this, they can show themselves as more advanced or more progressive, which is again not true. Also, there's a very big role played by media like television, movies, and newspapers and internet. So what you can see in today's you can see the content that they're showing in televisions and in internet, in movies. So you can see that a lot of stories, wherein the role played by the actors and actresses, they're smoking, they're taking in drugs. So basically, they are showing that it's cool to take those things, or you can take those things. They are showing these things in the movies, by which again these people are also learning from there that they can also do that thing. So they are promoting this perception that you can use these things to temporary escape from your problems. Okay, so also sometimes what has happening is that when the family is not supporting the person, when there's the family, the environment in the family is not stable, and there's too much pressure. Also, then these people, this young generation, this young people, or you can say even there are even yeah, not young, but there are even elders, you can say above 30, 40 age, who are also again going, moving towards this drugs and alcohol, moving to now. Now, once some people have taken these drugs, alcohol, some they are able to come out, okay, but some they get addicted to this. Some they start depending on these drugs and alcohol every day to relieve themselves from the stress pressure. Okay, so again, this addictive potential. Okay, now we'll come to a very important topic of addiction and dependence. Okay, as I've told you in my one of my slide that being addicted to something and being dependent on something are two different things. So addiction is what? Addiction means what? Like suppose you are taking drugs, so it's giving you a temporary feeling of, like suppose if you take a drug, you are feeling good. That means what? If you take drugs and alcohol, you will be feeling good. There's a temporary feeling of well-being. So this is known as addiction. Okay, you are being attached to the effects of that alcohol or drugs. Okay, when you're getting attached to the effects of the alcohol. So what are the effects? The temporary feeling of pleasure, that well-being feeling. So when you're attached to that effect, it's known as addiction. Now, what is dependence? Suppose a person is being continuously, he or she is taking that drug, and suddenly that drug has been stopped. Okay, it has been discontinued. So then what happens? That person starts feeling an unpleasant withdrawal syndrome. Okay, that person's body starts to feel like feel withdrawn. Okay, it feels withdrawn or unpleasant because of not getting the drug. Okay, not like not getting the feeling, not getting the drug. Okay, so that means what? The person is dependent on that drug or alcohol. His body is dependent on that drug and alcohol. Okay, otherwise its body is feeling withdrawn from everything around. Okay, this one has withdrawal syndrome. So when the body is dependent on a certain drug or alcohol, especially as a dose of a particular dose. Okay, so it's known as dependence. So what are the symptoms of this dependence? Okay, what's happening? So you can see that people, they start feeling anxiety, they'll start sweating, they'll feel nausea, shakiness, and you can see if once you again start giving them those drugs, they'll feel okay, fine. So sometimes what happens, some people even take their lives. Okay, when there's a withdrawal syndrome, when they start feeling this withdrawal syndrome symptoms, so what happens, they start it becomes life threatening, they may try to take away their life. Okay, third is that this type of people, they need proper medical supervision. They need to be admitted to the hospital and supervised. Okay, last is that sometimes what happens, when these people are dependent on drugs and alcohol, okay, they will forget what is right, what is legal, okay, what is illegal. They'll forget everything because they only want to satisfy their body's needs. Okay, they'll do anything to get the money. They will do anything to obtain that drugs or alcohol. Okay, now, what are the effects of drug and alcohol? So people who are taking this drug and alcohol, you will see that their behavior is changing. Their behavior becomes very reckless. Okay, their behavior becomes reckless. They will also vandalism, means they'll start becoming violent. The nature will become violent. Okay, they'll start using the words, the bad words. Okay, they start using bad words. They are not behaving normally. Fine. Also it may lead to coma and death. Sometimes it may lead to heart failure, or it may affect the brain. Cerebral hemorrhage can occur also. Fine. Basically, remember this. Too much. This effect can lead to coma, death. We know that coma can lead to death. Also, respiratory failure because too much alcohol, too much smoking, and all this can cause respiratory failure, heart failure because of drugs, too much of pressure, blood pressure. Also, it can reach the brain and cause cerebral hemorrhage. Remember this. Okay, so as I've told, sometimes people to satiate their need for these drugs, they can use different type of drugs, and which will can lead to overdosing and even death also. Sometimes it may also lead to academic drop in academic performance. Okay, and also you will see sometimes they miss the college, they miss the school because they're always feeling sleepy or anxiety, or they're always feeling scared, that type of thing. They'll start withdrawing themselves from the society. Okay. Also, the lack of interest in personal hygiene, as I've told, withdrawal, I've already told you. Then depression, fatigue, aggressive behavior, rebellious behavior. Fine. Also, you will see that their relationship with their families and friends are also becoming bad. They start losing their interest in hobbies. Their sleeping habits, eating habits, these all change. Their weight changes, their appetite changes. Okay, and sometimes if the person is not getting proper money to buy the drugs or alcohol, they may also turn to stealing. Okay, so basically these are type of some type of the effects. Also, when this type of people, when they do all these things, okay, they cause mental and financial distress to the family and friends. Okay, people start feeling ashamed of those people. So it also leads to a degradation of their society social reputation, you can say that. Okay, so what are the other effects is that sometimes if you okay, now if this is very important, if they're using drugs, okay, they use injection. So when they are using needle out here, so continuously if you are using the same needle, it may lead to AIDS, it may lead to hepatitis B. Also, too much drinking will lead to heavy drinking and alcohol addiction and all. Also, as I've told you, it will lead to nervous system damage and liver damage, also known as cirrhosis. You know that alcohol, too much drinking also will lead to liver cirrhosis. Okay, so now also in pregnancy, if a woman is consuming drugs and alcohol, it will affect the fetus. And this is a very important one. So you have heard about sportsmen using drugs to enhance their performance because they need more energy, they need more stamina, they need their brain to be always active. Okay, they need the muscle strength, and they need to be very aggressive. So they misuse the drugs. Okay, so sometimes there are some side effects in male and female because of using too much of this steroids. Okay, so in females it may lead to masculinization, increased aggressiveness, mood swings, depression, abnormal menstrual cycles, excessive hair growth on face and body, the voice changes. Even in males, it may lead to acne and also aggressiveness, again, mood swings, depression. So there are many type of side effects that are occurring in male and females. Also, sometimes it leads to a stunted growth, or you can say short. Okay, the growth stops. You can say. Now, how can you prevent this alcohol and drug abuse? So first of all, proper education and guidance, very very important out here. Parents, friends, teachers, they all have a role to play out here. When you give proper education and guidance to a person, to a child, or to your friend, whoever you feel is needs it, you should try to educate them, give them proper guidance, because alcohol and drugs is not the solution to life's problems. Second is to avoid undue peer pressure. So sometimes you have to avoid this peer pressure because there is too much pressure. There's always pressure, but you have to avoid that pressure. Suppose if it's not required, don't take the pressure. If it's required, you can take it, solve it. If you can't solve it, leave it. Don't take the pressure, just avoid it. Third is education and counseling. You need to be properly educated about the drugs, about alcohol, what does it do, and what are the bad effects of alcohol. You need to you need to counsel those people, or those people need to understand, okay, what are the consequences of drugs and alcohol, okay, how they can be used properly and how they are misused. So seeking help from parents and peers. If you feel that you are becoming inclined to drugs and alcohol, if you feel you are getting addicted or dependent on them, you should try to seek help from parents or from peers. And not only parents and peers, you can also go talk to your friends, you can talk to teachers, you can talk to any person whom you feel can help you, who can feel they can guide you, they can educate you. Okay, last is looking for danger signs. Suppose you find a person nearby you whom you think is always going through pressure, having anxiety problems, always being depressed, or they're always you feel that they're going some through some pain or something, like, you should always look for those danger signs and you should always try to help that person. Last is seeking professional and medical help. When you cannot help that person, when that person cannot be helped at all, you should completely go for medical help and professional help. There are many professional, there are many NGOs, there are many doctors, there are many organizations which are helping such type of people. You should immediately contact those people and take professional and medical help. So this is how you can prevent the drug and alcohol abuse. So this is all in today's class of drugs and alcohol abuse. I hope you have liked it. please do click on the like icon if you really think it's helpful for you, and please do share it, and please do subscribe to my channel for more such videos. Okay, thank you so much for attending today's class. I hope you have liked it. Thank you.